Hello and welcome to Senior Gap Benefits. My name is Rich Pasquale and I am an independent insurance agent who specializes in Medicare supplements. So Medicare has three parts, A, B, and D. Today in this video we're going to focus on Part A, what it entails, how do you qualify, what's covered, etc. Let's get to it. So a little housekeeping before we jump in to the Part A of Medicare. I plan on doing a video for each part of Medicare, so it's not too overwhelming. I like to keep it in sequence if I can. So be sure to hit the subscribe button. Also hit the little bell to the right of the subscribe button. That will notify you of any new videos that are coming up. Also, another thing I would recommend, if you have a question, before you forget, write it down. You can write it down, but you can also leave it in a comment below, and I will get back to you with your answer. And again, you can always call our 800 number on the screen. Our services are 100% free of charge, and we're here to serve. Without further ado, let's get into Medicare Part A. Medicare Part A, for most individuals, is premium free. As long as you've worked at least 10 years, you or your spouse have worked at least 10 years, there would be a zero premium for both of you. Again, it covers facilities, hospital stays. There is a benefit period deductible of $1,340. Obviously, that can change, but for 2018, it is $1,340. Now, what does that mean when I say benefit period, right? I didn't say an annual deductible. If you notice, I said benefit period. What happens is if you're admitted to the hospital, let's say you're there from 0 to 60 days, then you're responsible for the first $1,340 of that bill. And then Medicare Part A kicks in and pays for anything above and beyond the $1,340. Now, that's for a 0 to 60 day period. So if you're admitted for a week and then you come back a month later and you're admitted again, so you don't have to pay the $1,340 deductible again, assuming the bill the first time was over $1,340. But let's say that you were admitted week 1, right, for a week, and the total bill was $3,000. So you're responsible for $1,340 of that total bill. Medicare Part A will cover anything north of $1,340. And let's say you're discharged from the hospital, but then you're admitted toward the later part of the year, let's say 4 months later within the same year, you're admitted to the hospital again. Unfortunately, that's a new benefit period because anything past 60 days starts the clock all over again, and now you have to pay the deductible again. So that's Medicare Part A. Yes, there's zero monthly premium, but there is that $1,340 deductible. So when can I start receiving my Medicare Part A benefits? So to qualify for Medicare, once you have the 10-year work history, you're 64 years old, you're about to turn 65 this year. So 3 months before your birthday month and 3 months after your birthday month, which is a total 7-month period, you can apply for Medicare Part A. You would simply just go, you have a couple of choices. You can go on socialsecurity.gov and apply online. You can also go to you can make an appointment to your local Social Security Administration office and go there, or you can call them on an 800 number. If you're 65 and you're already receiving Social Security benefits, then chances are you will be automatically enrolled into your Medicare Part A. So if you're not receiving your Social Security benefits, if you've deferred, maybe you're still working, what you can do is, and you can go ahead and apply online through the socialsecurity.gov. You can call the 800 number and apply via telephone, or you can schedule an appointment to go down to your local Social Security office and apply that way. So what's covered? So we touched on hospital care. There's also skilled nursing facilities that are covered. Hospice is also covered by Medicare Part A. And there's also home health services that are covered by Medicare Part A. So that is it, folks. Medicare Part A in a nutshell. Okay, so if you have any questions, feel free to comment below. Also, you can call the 800 number on the screen. I'm here to answer any of your questions. Our services, again, are 100% free of charge to you. So give us a call, leave a comment below. And again, make sure you subscribe and hit the notification bell to be notified of our other videos. So on our next video, I plan on covering Medicare Part B, and then D, and then we'll dive into the Medicare guide. And if you have any suggestions on what you would like for me to do a video on, please feel free to comment below, and I'll do my best to answer your questions or make a video if anyway. Thanks again. My name is Rich Pasquale with Senior Gap Benefits, and I'll see you on the next one.